Hello, and welcome to our live Zoom portion of our event. Again, I'm Kelly Nomura, the Director of the Behavioral Health and Recovery Division. Legislators, please use the unique link that you were sent by email to join this part of the program so that we can hear from you. We'll give everyone a little more time to join. Great. Good to see all of you. Thank you for being with us this evening. We've got a couple more joining in as we're speaking, so just give them a little more time for the transition. All right, why don't we go ahead and get started. Again, thank you all for being with us tonight. I'm Kelly from the Behavioral Health and Recovery Division. I know that we had some difficulties in our early phase of tonight's program, in particular in our conversations with all of our lawmakers and legislators, and I just am so sorry that we had some difficulties. Appreciate everyone hanging in there, and I know that we were able to get people into the different rooms, so I hope that although the time was more limited than we had hoped, that you were able to have some good conversations. So appreciate your patience through that. And I also hope that you were here earlier to hear the wonderful, wonderful recovery stories. I want to thank Michael, Uba, Kimberly, and Jared for sharing their stories, for being part of our evening tonight, and just really reinforcing the importance and value of the behavioral health services that we are providing across King County, and the importance of our legislative priorities tonight to support all of those individuals in King County needing and accessing services. So thank you to our speakers. So now we would like to hear from our legislators. Thank you again for being here, and we welcome your comments. We're particularly interested in hearing your thoughts about what you heard tonight during our program, or if you have comments on priorities around mental health and substance use recovery for 2022. I will be calling on you by district, so you'll be able to join once your district is called. Please introduce yourself and take about 1 minute. I know that's not a lot of time, but about 1 minute or so for your comments. And we'll go through the different districts and then wrap up our evening tonight. So again, thank you for being here. Let's start with legislators from District 1. Do we have any legislators from the 1st district who would like to introduce yourselves and make some brief comments? Okay, District 5.
Hello, I'm Representative Lisa Callan, and I'm so appreciative of being here and so thankful for the speakers tonight, sharing your stories that are just exemplary of how the system is showing up for you and how it has failed you and how it has provided supports and all the work that we have yet to do. So huge thanks for that. I serve on the state's Children and Youth Behavioral Health Work Group, and I know we're just got a minute, so I'm just going to tell you that there's significant alignment between the recommendations that came from the Children and Youth Behavioral Health Work Group and King County's legislative agenda on behavioral health. So thank you for that work, and I look forward to our continued partnership to see how much we could actually get accomplished in the supplemental year. I'm very excited about the potential and happy to partner in this work with you.
Thank you so much. Anyone else from District 5? All right, let's move to District 30. Do we have any representatives from District 30?
Well, I was going to let my esteemed colleague, Rep. Taylor, go first.
Well, I was gonna do the same for you. I'm Representative Jamila Taylor out of the 30th District, recently elected, and I would say my priority in terms of the 30th District is South King County, so Federal Way, a little bit of Pierce County, and Senator Wilson will give the rest of our district as we normally do. I have been focused on the response to the Blake decision, which decriminalized controlled possession of controlled substance, and I work in partnership with Rep. Davis, who is the queen of behavioral health from the Blake angle, and of course a lot of other legislators who are on this call today. And so I'm really fascinated around how we build out the support systems in addition to just treatment. And so this is an amazing evening, and thank you so much for allowing me to participate.
Senator Claire Wilson, I have the esteemed pleasure of having Rep. Taylor as my colleague in the 30th Legislative District, which also includes unincorporated Auburn, Des Moines, Algona Pacific, and a little bit of Milton. And I had a wonderful group of individuals from our community to talk with early, and really focused on helping professions. And again, we know just right now, the stress that individuals are under, and then when you add the work that you do to support others, how much that adds to financial challenges, anxiety, housing issues, mental health issues, and all of those things. We talked about working with Judge Larson in our own community and work that he's currently doing in this arena. There was concern around youth suicide. So lots of conversation around that. And I will say Rep. Taylor, Blake, as well as police reform was part of our conversation, again, about solutions and focus and support for constituents in the 30th and the state of Washington. Happy to be here tonight, and thanks so much for sharing.
Thank you so much. And now let's move to District 31. Anyone from District 31? Okay. District 32, I know we have a few of you here tonight. Thank you for being here.
Hi, everyone. My name is Cindy Ryu, State Representative from the 32nd LD, which includes Shoreline, as well as the northwest corner of Seattle, and then the southwest corner of Snohomish County. I actually am very happy to be the senior member of the two-person team that we have in the House, with Representative Lauren Davis taking a huge lead within the House, along with many other colleagues, in making sure that we do not only work on the policy side, but also on the funding side. Because of the very capable Representative Davis's work, I am able to concentrate on what I like to work on, which includes, of course, housing, but also things such as broadband and telecom and other, I guess, supply side of things such as community and economic development. So the one issue that I do appreciate our caucus being able to address is culturally appropriate care. And so I really look forward to my seatmate, as well as the rest of our very fine group of legislators, King County legislators, who are all pulling together in the same direction. And so I look forward to this conversation. Thank you.
Thank you.
Good evening, everybody. I am the junior member of the delegation, Lauren Davis, and very honored to serve with Rep. Rio. Just want to thank everybody so much for being here tonight. I know many of you in the audience, and you guys are my friends and my colleagues and my teachers and my mentors. It's always wonderful to come to this event. This is my 9th Behavioral Health Legislative Forum. I attended when I knew absolutely no one and had no qualification to speak or do anything in behavioral health whatsoever, and was very intimidated by all the lawmakers on the stage. And yet life happened, and here we are. But just grateful to share the space with you tonight. Very grateful to the individuals in recovery for sharing your stories. The one thing that I'll mention in my 1 minute actually is the legislature has done a lot in behavioral health, especially the last several years. And what I really want to ask and actually beg of all of you tonight is to help us with the implementation. Yes, this whole point of this forum is about forward looking, but man, we did some big stuff this last session. The Blake state's response to the Blake decision, the 988 bill, and a myriad of other things, and there's more to come, but there were 74 provisos for the healthcare authority around behavioral health, which is an unprecedented number. And if we want those things to meet their mark, we need all of you. We need people in recovery. We need families. We need frontline providers. Please don't take your eye off the ball. And we legislators need to make sure that we also stay equally focused on implementation as much as looking forward to the next session. So please reach out anytime if you've got any ideas around anything remotely related to behavioral health. Thank you.
Thank you. All right. District 33. Do we have anyone from District 33? Representative.
Representative Eileen Cody from the 34th District, which is West Seattle, Vashon, and Burien. And I'm also the chair of the House Healthcare Committee, which is where most of the behavioral health stuff comes through in the House. And I would say that what we're really, at least what I've been focusing on with several others in the House this interim has been to work on our workforce. So we've heard loud and clear about the need to increase rates for especially in behavioral health to be able to retain workforce, but it's not just the retention. We got to get cranking out more providers. So we are working on that and really focused on trying to figure out what we can do to attract people into behavioral health and just to healthcare workforce in general.
Thank you. All right, District 36. I know we have someone from 36.
Hi, I'm Reuven Carlisle, Senator from 36, which is Northwest Seattle. Just a real pleasure to be here once again. And we had a fabulous conversation in our earlier breakout room where a lot of practitioners were talking about the implications of housing first. It was just a really substantive and thoughtful conversation. I really appreciated that. I always enjoy it. And I just really appreciate being with everyone again this year, and just appreciate the magnitude of the transition in the last couple of years into an acknowledgement of the magnitude of the importance of behavioral health. And no one questions the need for integration with our broader healthcare system now. And that's been a fabulous, fabulous systems improvement. And I really appreciate everyone sharing their story.
Thank you.
Good evening. This is Representative Ramos from the 36th District. I want to echo what my senator just said about the conversations we had in our breakout group about housing, health care through housing, as we've heard from King County, is so important. I also just appreciate the conversation we had in our breakout about complex trauma, complex PTSD, and developmental trauma, which was a term I actually had not heard before, but it was clearly a word to describe what I have personally experienced and the issues that I've worked on in the legislature as a survivor of childhood sexual abuse and someone working with kids in care in the dependency system who've also experienced similar traumas. So I was grateful for the connections and work that I hope to pick up again in the future. This is hard work, as we all know. We all have secondary trauma from doing work in behavioral health, and so I appreciate all of you. I will say my focus in the next year, as a relatively new member of the Appropriations Committee, will continue to partner with Representative Sen in her capacity as chairing the Children, Youth, and Families Committee, Representatives Davis, Representative Callan with their work on the Children and Youth Behavioral Health Work Group to implement what they see as the priorities. And then as the chair of the House Finance Committee, continuing to work to improve our state's tax structure so that we have a sustainable tax structure to provide the funding we need for these key services for our community. So thank you all for sharing your stories and having us tonight.
Thank you. All right, District 41.
Good evening, I'm Tana Sen, the senior member from the 41st Legislative District, and proud to chair the Children, Youth, and Families Committee in the House. And it is apropos that this legislative session, without a doubt, the two biggest issues in our committee will be around children's mental health and adolescent services. and is proud to be able to really emphasize adolescent services as we've been discussing the Blake decision, to make sure that our youth are not overlooked because they do have special and distinct needs from adults when it comes to mental health and when it comes to substance abuse and it comes to trauma. And so really putting the exclamation point on helping youth and going upstream in trying to prevent and reduce as much trauma as we can. So I will continue to focus on the prevention, and again, thrilled to work with all of my colleagues and all of you on really addressing especially children's mental health, but mental health access overall. Thank you.
Thank you.
Thank you. I'm the junior legislators on the 41st Legislative District, and I'm happy to be in this space with you. Very much appreciative of the story shared in the earlier sessions, and very informative. I serve on housing, human services, and veterans. I also serve on finance. Last sessions, we passed a working family tax exemption. This sessions, I am working on ensuring the implementation of that work with fidelity, so that those who are hardworking individuals, hardworking families in our state get the tax exemption they needed for their well-being. Like many of my colleagues who have shared, the top priority for our session certainly is going to be anchored around mental and behavioral health support and services. Definitely around workforce development to ensure that the services will be provided by highly qualified individuals. And I think I heard briefly from Representative Ryu's speak specifically around the cultural and linguistic sensitivity and relevancy. I am working, and I'm hoping if anybody who has a personal direction, a direct line to Governor Inslee, I would very much like to see that he included in the budget the looking at ensuring, well, as a refugee myself and still be the first refugee elected to serve in Washington State Legislature, I'm looking at our state to learn from what we have learned before. This is not new. A lot of the refugees and immigrants who come into our country, into our state, are talented. They are talented, and they have exactly that, the cultural and the linguistic knowledge. And if they have served in the capacity in their home country, why can't we, making sure that they too get to contribute to their second home, be an active member in our community? And that is what I'd like to see us moving forward as we welcome more of our Afghan refugees into our county. Thank you.
Thank you. And District 43.
Hi, everyone. I'll start because I know my seatmate would love for me to start. Hi, everyone. I'm Nicole Macri, State Representative from the 43rd Legislative District, and I'm so sorry I can't see folks' faces, but it's wonderful to see all the names, many familiar names, and some unfamiliar names with some 43rd District next to them. So it's really great to be here. I want to just first acknowledge what we've all been through collectively over the last 2 years. This has been a very difficult time for all of us. And I think it's important that we acknowledge that and give ourselves grace around that. I'm just really grateful for everyone continuing to show up to advocate for behavioral health services. We have taken tremendous strides, but we still have a really long way to go, and the pandemic has thrown definitely new challenges at us. I'm so grateful to all the folks who spoke and shared your deeply personal experiences and stories. They are really helpful to us. They keep us grounded in the importance and urgency of what we as policymakers need to do. They help to break down the stigma. If there is a silver lining in the pandemic, it is that more and more people are willing to acknowledge the challenges around behavioral health that many of us have gone through and are going through. So thank you for sharing your own stories. We have a lot of work to do in this 22 legislative session. A lot of my colleagues have talked about a lot of the priorities. One of the roles that I play is a vice chair on the appropriations committee, so working on our operating budget. So looking at workforce issues is very important. It's great to see so many people I know who work in behavioral health who are here today. Thank you, thank you, thank you for all the work you're doing. We know we need to help make sure that you can sustain yourself in this work, and we will be working on that. And thank you, King County, for your very comprehensive legislative priority list. Thank you for putting permanent supportive housing on that list. Thank you to those of you who shared your own struggles with housing, Jared and Uba and others. Really appreciate that. We will continue to work on housing for people who have gone through behavioral health challenges. It remains a priority for us. There's lots of other stuff we're working on, but I'll leave it at that. I know I've exceeded my 1 minute, and I'll turn it over to my seatmate.
Thanks, Nicole. Great job. In fact, many things that you just said, I totally agree with, obviously. In fact, all of the things you said. I do want to recognize Claudia Balducci and Jeannie Cole-Wells for being here from the King County Council. Great to see you again. Thanks for all your great work. We are making progress, significant progress in terms of behavioral health. It's actually very exciting. And also because of all the folks here tonight on the legislative forum, I mean, every single one of the legislators have contributed to the effort in terms of behavioral health in a very direct way. Let me give you a few examples. We do want to say thank you for King County for finally implementing the 110 sales tax that created $400 million to buy housing. And that's great. Thanks, Claudia. Thanks, Jeannie. And thanks to everybody else. We have to carry that out and make sure it works because we want to do more. And I'll get to that in just a second. But the money is there not just for capital costs, but some money for services through the mental health funding that Kelly had talked about. The second highlight is we just did a groundbreaking of the University of Washington Behavioral Health Teaching Hospital, which is being built as we speak out at Northwest Hospital in North Seattle. That'll really significantly add to the capacity for behavioral health workforce, as well as providing 150 beds to care for people, not just with mental health issues, but also with substance use disorder concerns. And we really are proud about that. The legislature put in $240 million to actually build the thing. I do have to mention Senator David Frock, who really helped on the capital budget for that. Thanks, David. He's not here tonight, but send him good wishes. A third one is that I started a program called Home and Hope a few years ago, and we are now acquiring and developing over 20 major sites in King County for affordable housing, including supportive housing and other community services, early learning, childcare, community health clinics, you name it. So please work with us to how we can work together and build partnerships to do even more in the future, because we'll need that extra capacity. Next two steps. I totally agree with what everybody said about behavioral health workforce. I don't have to go into it in detail because you got so many advocates. It's just great, but we got to follow through, as Lauren Davis said, and actually implement what we're doing. The big one, though, I want to mention at the end here is that we have a concerted effort to advance the whole concept of health and homes. That is similar to health and housing that King County has named their particular program. But we are proposing legislation, the Apple Health and Homes Act of 2022, and it'll be pushing two particular projects, or two particular efforts rather. One is $500 million in federal ARPA funds to buy or construct supportive housing for those who need the housing, who are chronically homeless as a result of behavioral health concerns, mental illness, substance use disorder. This is a big step forward But it's only one-time money, so we got to go beyond that on an ongoing basis. And so we're proposing a prescription for a home in state law to connect the people who are chronically homeless because of their behavioral health conditions to actually make the connection to the home. I mean, we cover all sorts of expenses in this state for healthcare, rightfully so. We have 1.8 million people in the state of Washington on Apple Health. What we're talking about is 6,000 to 12,000 people statewide that also need a home in addition to the healthcare. So please work together with us on this. It's extremely important. It would be the first in the nation to actually do it. It's not easy. We have to phase it in, but I'm extremely grateful to Nicole and many others involved in the legislature who are helping push this through. So anyway, I'm really excited. I'm so glad to be here. Thank you very much.
Thank you. Thank you. All right. Now let's go to, I see we have some representatives from the 46th.
Rep. Valdez, do you want to go?
Go ahead, Jerry, you're the senior member.
Oh, the white hair gets me something. I just want to say a heartfelt thank you to the people who joined in the conversation from 5:30 to 6:30, and let's stay in touch. And not only thank you for the people who share their personal stories every year, that it's been so well expressed how important they are to policymakers, but thank you to all the fellow elected officials and all the people in our behavioral health and housing agencies who are doing such great work. It's incredible to me to listen to what so many of my colleagues are doing. Thank you all.
And good evening, everyone. Javier Valdez from the 46. Again, it's an honor to be here. I'm here every year, and so it's just a great event. I had a great conversation with about 10 constituents from the 46th district. 3 highlights, and they've actually all been covered. We definitely had a great discussion about the need to increase our rates, as so many of our providers out there are having to, think about or have left the profession because we're just not keeping up, being able to pay them on an equitable basis. The second point, which Representative Chop spoke about, was again our brand new facility right here in the 46 at Northwest Hospital. We're certainly excited about what's going to be happening there, and of course, I also gave a shout out to Senator Frock from our own 46 for all his work to make that happen. And in terms, I think of our last third point, which really, of course, it's been discussed already. It's about housing. Sure, we can provide, temporary housing or hotel housing or transitional housing, but much more that we need to do for our most vulnerable populations, getting into real permanent housing. That's one of the best solutions that we can provide. And in terms of my highest priority, of my priorities this year in the legislative session, it's the same one I've had for the last 4 years, which is a bill on gun safety, which is the bill that would limit the amount of high capacity magazines that an individual can purchase and possess. So I'm hopeful this year in 2021, we can finally get that across the finish line. Thank you.
Thank you. Thank you. I'm going to go back to a few districts that I think we did not have you on the line and when we started. So I want to make sure that we give you an opportunity to share your comments. So let's go back to the 1st district, Representative Kloba.
Good evening. Thank you so much. I have to admit that I was not able to attend the entire thing, even though I really think it's one of the best events that we have all year of these type. I was taking care of my own mental health and going to my yoga class, which, we all have to have those things that get us through and keep us on an even keel. So I was practicing what we all need to be doing for ourselves to get through. So it is always, to me, an honor to hear the stories that people bring. And I apologize that I missed it this time. But the second thing is to be standing arm in arm with these amazing colleagues who care so deeply and are, such warriors and come up with such great ideas. My committee areas don't necessarily touch a lot onto these issues. However, you know, I can always be depended on to put people first and behavioral health as well as our physical health. So it's always just an educational opportunity. I never get to be in the same room with these people anymore because of COVID. And so it's nice to hear what everybody is working on, and you can bet I will be right there along with you. So thank you.
Thank you. All right, District 5, Representative Ramos.
Thank you very much. Bill Ramos here. And just thank you all very much for everybody being here, doing the work. I can't thank you enough. Everybody that's involved is keeping this going. Workforce is an issue, so my big concern is keeping the workforce we have right now healthy and strong, taking care of yourself. So you're here as we're trying to hopefully get you reinforcements, but they take a while. You know, there's a little bit involved there. And so I'm hoping that to speed those things up, the things that are important to me, the peer-to-peer certification, that we can get more of those in, because we can get those folks ready faster and they can come and help. And the big thing they will also help bring to us is the cultural relevancy, because they're coming from the world of the experience, and that will help bring those faster. So hopefully we'll work in that arena mostly a lot to get things going as quickly as possible as we work to solve this in the long term. And just thank you so much for keeping everyone going, and take care of yourself as you serve the people. Thank you.
Thank you. And District 11, Senator Hasagawa.
Hi, thank you. I was not assigned to the 11th district, I guess, so I'm sorry about that, but we caught a lot of, I'm trying to find my notes that I took from this thing. I just clicked off of it when I was shifting pages, but I heard a lot of issues that were raised from response times and how there's a crisis in DCR workload and the number of DCRs that they even have, and how the need for, there's funding need for increasing workforce there. And I know that Representative Tai suggested, and it was also raised in our work group, that you know, there's immigrants who are trained to do this kind of work, but they're not allowed to become certified to do that. So there's work that we can be doing there. I think it's important, though, that as we look at our responses to the crisis, we have to keep in mind the root causes and some of the fundamental things that lead to behavioral health crisis in individuals. You know, the COVID impacts has put a lot of stressors on individuals and families, and the disparities and how those impact communities of color have to be recognized. So there was a big conversation in our group about cultural competency and responses to these crises. We also heard that there's a big need for funding increases. So at this point, I usually try to make the pitch that we recognize that there's a funding crisis to not just this behavioral health issues, but to most of the social safety nets issues that we as a responsibility in a humane society should be funding. So in return for consideration for those increases in funding to the necessary levels, I would ask of you all to really support what Representative Frame has been leading the charge on, which is an evaluation of reforming our revenue structure so that we can actually have adequate revenues to fund all of our social services. So we actually need a comprehensive progressive revenue structure in our state, and Representative Frame has been leading that charge. And I hope that you put that on your legislative agenda, because your voices will add a lot of power to the push to get that done. And that's fundamental to our improving all of our social safety net systems, including mental and behavioral health. Thanks for that time.
Thank you. And before I move to comments from our King County Council members, I believe Representative Eslick would like to say something again.
Thank you. Yes, I am in the 39th, not the 34th, as it was on the front page of the website. So I think I got kind of lost. I only have 107 people in King County in my district, 39. My district is East Snohomish County and East Skagit County. So I had no one in my group. And so I joined the group that had no legislator. And I was very pleased to do that, because hearing everything that they had to say was everything that I'd been hearing all summer long in our work group. I'm very fortunate to be in the children family work group, but also the subgroup of the YAC, that's the youth folks, with, and very honored to be able to work with Rep. Callan and Rep. Davis and Rep. Sen, and of course, before it was Rep. Frame. I have, what I'm really hoping to get accomplished this year is that we can, the budget include the full-time position that with the Healthcare Authority, so that they can educate the providers and our not only our providers, but our families about behavioral health and our new laws. That we're really great at making new laws, but we are not so good about implementing, as we have been working really hard and finding those loopholes and those areas that we need to work on. So by, I think, was it Rep. Davis that said she's recruiting all of you to help if you're involved in a mental health bill, to make sure that you follow it, not just the day that we implement it, but forever, because they are the most important. It doesn't work if we don't. So I'm thrilled to be here. It's been my pleasure. It's my first time in the King County, and looks like could be my last, because I have been redistricted out of King County. Thank you for the time.
Thank you for being here tonight. I want to turn, we have a few King County Council members. Thank you for joining us as well, and see if you would like to make any comments. Let's go ahead and start with Councilmember Cole-Wells. There she is.
Thank you very much. I really appreciate being here today. I represent District 4, which is all within the city of Seattle, mainly the northwest part. And I'd like to recognize Councilmember Claudia Balducci, who I'm hoping will be speaking. She's been an outstanding chair of the council during very difficult times with the pandemic for the past 2 years. Of course, we have no session coming up as we work year round, but I thought there might be a few items to cover that would be of interest to you. We just completed our 13th and last budget over these 2 COVID years. 8 of them were COVID budgets, and we're looking at our 9th COVID budget with remaining CARES Act and ARPA funds in March. But by far, and I think really relevant to everybody here, one of the most gratifying parts of our mid-biennial budget that was just approved by the council a couple of weeks ago was the restoration of the reductions made last year to the MID program, Mental Illness Drug Dependency Program. And we even added some expansions, which were made possible by improvements to the MID sales tax collections forecast. We also included some additional funding for fentanyl prevention and treatment. And I'm really pleased that we're now recovering to some extent from the recession. The Health Through Housing program was mentioned earlier, and it's really taking off. Thank you very much to our legislators for granting us the taxing authority. But today we approved the implementation plan. It was approved unanimously by the King County Council, and we'll be providing significant differences in providing permanent supportive safe housing for chronically unhoused with behavioral health needs. Tomorrow in the Budget Fiscal Management Committee, which I chair, will likely be taking action on agreement with the city of Seattle for the county to acquire City Hall Park next to the county courthouse, which was closed by the city in late summer. It's had quite a history. We will continue to be working with community partners such as DESC and the Defenders Association with the Just Cares program and others. We also implemented a new restorative justice program, the community diversion program, to divert eligible individuals facing their first low-level property or drug felony to a community-based, culturally competent program in lieu of prosecution. And in this most current budget, as I mentioned, we also added a program supervisor and clinician to address the growing caseload in the King County Regional Mental Health Court, the King County Veterans Court, and the City of Seattle Mental Health Court and Veterans Court. So we're doing a lot. We're going to have a recess the last 2 weeks of December, and then we'll be right back on the job the first week of January. Thank you, Kelly.
Thank you. Councilmember Balducci.
Yeah, thank you so much. And thank you for inviting us. Two of these things are not like the others. Councilmember Colwells and I represent King County. She represents parts of Seattle, and I represent parts of East King County, Bellevue, Kirkland, Redmond, Mercer Island, some other places. And she did a very good job at describing some of our implementation work. So the state proposes, the locals dispose. So when you come up with great ideas and funding options, it's on us, and many times at the local level to make those things happen. And I'm also really proud of our Health Through Housing program that several people have already talked about. So I'll turn and say just a word about what I am hearing at the local level is sort of the biggest crying need that's getting in the way of some of our work for people who are in crisis and people who need behavioral and mental health services. And we are all putting a lot of our efforts into dealing with homelessness in King County and in the rest of the state. It is an absolute huge challenge that we're all facing, and people are outside, they're suffering. We have an unfortunately very high level of deaths outside this year. And one of the things that we hear is that even if we've started up a new regional homelessness governance authority where the cities and the county are collaborating together, but we hear that even if we send out a lot of peer navigators, even if we send out social workers, even if we can get our arms around the challenges of making law enforcement responses more therapeutic, when people are in crisis and we go out and intervene with them, there's nowhere to send them. There's no, the facilities are lacking, and even if we had the facilities, the staffing is lacking. And so I just want to take this moment that I have to encourage all the work, the great work I've been hearing about from our state partners here tonight, to try to find a way to help build the workforce, support the workforce in mental and behavioral health in ways that enable them to stay doing this work that's very, very difficult and very, requires a lot of staying power and also, sort of better pay and benefits, let's just say it. So I really support that work, and we also have to work together to find places, facilities and buildings where people can do that work so we have a place for people to go. So much more to talk about, but you've been listening to us for a real long time, so I'm going to stop. And thank you again for inviting me and Jeannie and the rest of the King County Council to be a participant in this great event each year. It's really very inspirational, and it's nice to feel that we have a team that we're working on this together. Thank you.
Thank you. Now, I want to make sure that we haven't overlooked or missed any legislators or council members. So if we did not give you an opportunity to speak, please let us know. Hoping I caught everybody. Okay, thank you. So before we conclude, we're almost done for the evening. I know everybody's been part of this process for a little while now, so I appreciate everybody hanging in there. But before we conclude, I'd really like to take a moment to reflect on the importance and significance of today, December 7th. 80 years ago today, in 1941, Japan's Imperial Navy attacked the United States at Pearl Harbor in Honolulu, Hawaii. And this air raid killed over 2,400 servicemen and destroyed and damaged 19 US Navy ships. I know many of you are aware of this terrible attack against our country, but I wanted to make sure that you're aware of some injustices that followed. Following this attack on Pearl Harbor by Japan, people of Japanese descendants on the West Coast, many of them US citizens, were deemed a threat to the United States simply due to their Japanese ancestry. Over 112,000 were rounded up and incarcerated in internment camps for over 4 years. My own mother and father, both born in the United States, were 4 years old when they were sent to Minidoka, Idaho, and Poston, Arizona internment camps. They were 8 years old when released. My grandparents lost most of their personal belongings, their homes, and their successful businesses here in Seattle. 1,862 Japanese died while in camp. This forced relocation and internment is just one of several racial injustices in America's history. So we must continue to educate everyone on the hate and discrimination of our past, as well as raise awareness of what is still happening today. So I ask each of you to do your part to ensure equity and social justice for everyone. What will you do starting today? And that concludes our program tonight. I really want to thank our legislators and our members for being here. Thank you for your time, your words, and your support. And before we sign off, I just really quickly want to thank not only those elected officials here today, your legislative staff, our sponsoring organizations, everyone that is in mental health and substance use recovery in our communities, all of our behavioral health providers, our health and human service partners, our community members that have joined us tonight and are there every day in our communities. And a special thank you to Amanda Flatley, who is our Behavioral Health and Recovery Division staff, who worked many hours developing, organizing, and pulling off this event tonight. She's worked many hours over the past several months. We appreciate everyone's time and effort to be able to have tonight and hear from all of you and have you join us. So thank you again for being here for our Behavioral Health Legislative Forum in 2021. Truly hope that next year we will be in person again and be able to see all of you in person and connect and have those personal connections. That concludes our program. Thank you all. Have a good night.